Welcome to Ortho Reports. Today, we're diving deep into a fascinating case report that looks at a new way to fix one of the toughest injuries a surgeon can face, a wrist that's been completely shattered. We're going to explore the problem, the standard fix, and then a really promising, less invasive alternative.
So let's start with the big question, right? When a bone doesn't just crack, but literally explodes into tiny little pieces, how on earth do you even start to put it back together? That's the huge challenge we're looking at today.
And to really get why the solution is so clever, you first have to understand just how complex the problem is. This isn't your average clean break. We're talking about a very specific and very severe type of fracture.
Okay, the official medical term is a bit of a mouthful, a comminuted intra-articular distal radius fracture. Let's just break that down. The distal radius is the end of your main forearm bone, right at the wrist. Comminuted means it's shattered into multiple fragments. And intra-articular, this is the key part, means the break goes right into the smooth cartilage surface of the wrist joint itself, and that's what makes fixing it so incredibly difficult.
Honestly, this analogy is perfect. Just imagine trying to glue a crushed eggshell back together perfectly. That's the kind of precision we're talking about, because even the tiniest imperfection on that joint surface can lead to really bad arthritis and chronic pain down the line. It is a true high-stakes jigsaw puzzle.
So how do surgeons usually deal with this crushed eggshell problem? Let's take a look at what's considered the current gold standard.
The go-to method is a procedure called ORIF. That stands for open reduction and internal fixation. Basically, a surgeon makes an incision, physically moves the bone fragments back into place, that's the open reduction, and then bolts them all together from the inside with hardware, plates and screws.
But what if there's another way to do it? A method that doesn't need a huge incision or all that internal hardware? Well, this report is all about an approach like that, one that works from the outside in.
And this chart just breaks down the difference so clearly. On one side, you've got the standard ORIF surgery. Yeah, it's more invasive, but it gives the surgeon direct, hands-on control of every little piece. On the other side is what this study looked at, external fixation. It's minimally invasive, and it uses this cool external scaffold. The big plus, way less damage to all the surrounding soft tissues, which can mean fewer complications.
So, how does this external scaffold thing even work? Well, it's actually pretty brilliant. First, using an X-ray for guidance, the surgeon uses the tension from the body's own ligaments to gently pull all those bone fragments back into alignment. It's pretty neat. Then, they put on an external frame. It looks like a mini scaffold, and they attach it with pins to the bone above and below the fracture. That frame holds everything perfectly still for about 6 to 8 weeks, just giving the bone the stable environment it needs to heal itself.
Now, that all sounds great in theory, but does it actually work for these really bad fractures? Well, that's exactly what these researchers wanted to find out.
So here's a quick look at the study. They took 30 adult patients, and all of them had the most severe type of this fracture. Every single one was treated using this external fixator technique. Then, they were followed for a whole year to check on two main things: their functional outcome, so how well their hand actually worked, and their radiological outcome, which is how the bone looked on an X-ray.
All right, this is it, the moment of truth. What did the study actually find? Let's get into the numbers.
First up, let's talk about function. That's what really matters to the patient, right? Doctors use what's called a DASH score to measure how well someone can do daily tasks. Simple things like buttoning a shirt or carrying groceries. And the results here were, they were stunning. An incredible 93% of patients had an excellent outcome. They got almost all of their normal, everyday function back.
The final average score for these patients was just 14.2. Now, to give you some perspective, a score of 0 is perfect function, absolutely no disability. So to get a score this low after starting with a totally shattered wrist, that's just a phenomenal recovery. It means these people have very few limitations in their daily lives.
And believe it or not, the story gets even better when you look at the X-rays. The radiological outcome, which is all about how well the bone healed and kept its shape, was even more impressive. A staggering 97% of patients had an excellent result. This means the bone healed in a near-perfect position, which is absolutely critical if you want to prevent that long-term pain and arthritis we were talking about earlier.
So, with results this good, what's the big takeaway here? This study really forces us to ask a pretty important question about how we treat these really complicated injuries.
This slide really sums it up. On top of the fantastic patient outcomes, the procedure itself had a ton of benefits. There were very few complications with the surrounding tissues, the surgery was faster with less blood loss, and, this is a big one, It's actually a simpler technique for the surgeon to perform, which can be a huge deal in a busy trauma center.
Now, of course, good science is always honest about its limits, and the authors here are quick to point out a few things. It was a pretty small study, only 30 patients. There wasn't a control group getting the standard surgery to compare against. And a one-year follow-up doesn't tell us about really long-term issues like arthritis. But this isn't a failure, it's just a roadmap for what to study next.
The author's final conclusion is just so direct and powerful. They state that this external scaffolding technique is, quote, a valuable and effective alternative for dealing with these tough fractures, really emphasizing its simplicity and lower risks.
And that really brings us to our final big picture question. This research, yeah, it's focused on the wrist, but it makes you wonder about a broader point in medicine. Do our most complex injuries always need our most invasive solutions? Or, like this study suggests, could a simpler, less invasive approach sometimes be even more effective? It's a really powerful idea to think about. Thanks so much for watching.